Gender identity disorder. Gender dysphoria, or as it is referred to in the DSM-4, gender identity disorder, is a complex condition which can be difficult to understand. This video will firstly outline the terminology associated with the condition to help understand what it means to have gender identity disorder. We will then go on to talk about who this might affect and when, following which we will look at the symptoms associated with gender identity disorder. We will then talk about how a person living with gender identity disorder may feel. We will also consider the various explanations as to what may cause or influence a person to have gender identity disorder. And finally, we will look at what treatments and support is available for people facing difficulties with gender identity. Gender dysphoria is a condition that describes the feeling of being trapped in the body of the wrong sex. Gender identity is the gender you feel you should be. Transsexual is someone with an extreme and long-term case of gender dysphoria who seeks to alter their biological sex to match their gender identity. Gender can be described in very narrow terms, such as the genitalia you were born with. However, many transsexuals and experts in treating gender identity disorder find these definitions unhelpful and offensive. One response to this is that gender is an individual choice. If you regard yourself as a man or woman, you should have the right to be treated as one. Gender identity disorder must also not be confused with homosexuality, as gender identity confusion is not necessarily associated with sexuality. Sexual preference varies between people with gender identity disorder. The symptoms of gender identity disorder are usually recognisable from early childhood. For example, a child may refuse to wear typical boys' or girls' clothes, or dislike taking part in typical boys' or girls' games and activities. In most cases, this behaviour is a normal part of growing up. In the case of gender identity disorder, this continues throughout childhood to adulthood. Symptoms in children are characterised as insisting they are the opposite sex, disliking or refusing to wear the clothes that are typically worn by their sex, instead preferring to wear the clothes typically worn by the opposite sex, disliking or refusing to take part in activities and games which are typically meant for their sex, and wanting to take part in activities and games that are typically meant for the opposite sex. Disliking or refusing to pass urine as their sex usually does. For example, a boy may want to sit down to pass urine and a girl may want to stand up. Insisting or hoping their genitals will change. For example, a boy may want to be rid of his penis and a girl may want to grow a penis. Feelings of extreme distress at the physical changes of puberty, and some may suffer from depression and anxiety and withdraw from social interaction. As mentioned, in most cases these behaviours are considered a normal part of growing up. A child may display some or all of these characteristics, but this does not mean that a child has gender identity disorder. For example, the behaviour of many girls may be described as tomboyish. This is often seen as a normal part of female development, just as some boys may role play as girls and dress in mother's or sister's clothing. Although some may consider this less acceptable, it is usually just a phase. It is rare for these behaviours to persist throughout childhood to adulthood. Most children who behave in these ways do not have gender identity disorder or become transsexual. The mental health charity Mind estimate that the number of people who request gender reassignment surgery is around 1 in 100,000 women and 1 in 30,000 men. I'm now going to show you a short video clip of a little girl called Jazz who is 7 years old. Jazz is biologically male and in this clip offers her thoughts on gender identity disorder.
If someone asked me why I used to be a boy and now I'm a girl, I would say that I have a girl brain and boy body and I think like a girl, but I just have a boy body and it's different than you.
Is it okay to be different?
Yes.
You like it? Because why?
It's okay to be different. It's okay to be different because it just matters who you are. It doesn't matter if you're different than anybody else. It just matters if you're having a good time and you like who you are.
If these feelings or symptoms outlined are still present during adolescence through to adulthood, it is likely that this is not a phase. If you or somebody you know felt this way throughout childhood, by adulthood are likely to have a stronger sense of gender identity and how it should preferably be dealt with. In extreme cases of gender identity disorder, many people are fully transsexual by their teenage years. Teenagers and adults with gender identity disorder are likely to feel, without doubt, that your gender identity is at odds with your sex. Comfortable only when in the gender role of your preferred gender identity. A strong desire to be rid of the physical signs of your sex, such as breasts, body hair, and muscle definition. A strong dislike and a strong desire to change or be rid of the genitalia of your sex. And some may feel alone and suffer depression, and may withdraw from social interaction. People with gender identity disorder often explain that these feelings of being born the wrong physical sex have always been there. Both children and adults with gender identity disorder may often feel rejected by their peers and feel alone, which can result in social isolation, anxiety, and many other emotional problems or possible substance abuse. These feelings can often be very difficult to deal with, and as a result many transsexuals and people with gender identity disorder could experience depression or suicidal feelings. Here is an extract from the autobiography of Madeline Winston, a transgendered professor of psychology, discussing her personal experiences with gender dysphoria. It feels like everything should have been so obvious when I look back, but everything was so confusing as I grew up. It's like one day I was absent, and everybody else was taught the crucial aspects of being a boy or a girl. I would lie in bed at night, practicing and rehearsing how to be a boy. One day in middle school, after being pushed around again, the principal tried to teach me to stop crying and be a man. Bullies, teachers, and others taught me the same thing. There was something terribly wrong with my feelings. I tried so hard to purge myself from every expression of emotion. Really, I only needed to be taught one lesson. We do not need to learn to be ourselves, we just are ourselves. Or maybe what it means to be a person is that we invent ourselves. In 1998 I transitioned. I no longer practiced being a boy, I just became a girl. The possible causes of gender identity disorder are still debated today. Up until recently it was considered a purely psychiatric condition. However, more recent research has shown that gender identity disorder may have a biological cause, suggesting it could be associated with the development of gender identity before birth. Although more research is needed, most now agree that gender identity is not purely a psychiatric condition. In some cases, gender identity disorder is believed to be a result of hormonal dysfunction, whereby the hormones which trigger the development of sex and gender may not work properly on the brain and genitals, causing a variation between them, which means the sex of a person, as determined by the genitals, may be mismatched with the gender of a person, determined by the brain. This could be caused by additional hormones in the mother's system, or by the fetus's insensitivity to the hormones. This is known as androgen insensitivity syndrome, which means gender dysphoria could be caused by the hormones not working properly within the womb. Treatment aims to help people with gender identity disorder live the way they want to in their preferred gender identity. This will vary from person to person, and some people will need more treatment than others. There are a range of different treatments for gender identity disorder to be considered, Counselling should be offered to discuss the various treatment options available and implications. Children under 18 should be referred to a specialist child and adolescent gender identity clinic. These clinics offer ongoing assessments for children with gender dysphoria and specialised treatment and support for children and their families. Children are fully assessed before any treatment begins. Treatment for children should be arranged with a multidisciplinary team of different healthcare professionals working together, which may include a mental health professional who is trained in dealing with gender dysphoria in children and teenagers, and a paediatric endocrinologist, a specialist in hormone conditions in children. Children diagnosed with gender dysphoria before they have reached puberty will not receive any endocrine treatment. Endocrine treatment is a hormonal treatment. It is the first step in developing the physical signs of preferred gender. The reason this treatment is not available before puberty is due to the Endocrine Society finding that 75 to 80% of children diagnosed with gender dysphoria did not have this condition after puberty. Diagnosis of gender dysphoria is therefore not considered confirmed until after puberty. If a child has reached puberty and has been diagnosed with gender identity disorder or transsexualism, they may be treated with gonadotrophin-releasing hormone analogues. These synthetic hormones suppress the body's naturally produced hormones. This treatment halts the development of the physical biological changes of puberty. Puberty is divided into two stages known as the Tanner stages. Gonadotrophin-releasing hormone analogues may be considered at stage 2, whereby a number of physical changes have occurred, such as pubic hair growth. A recommendation for this treatment must come from a mental health professional who is to be a continuing part of the child's ongoing care. An endocrinologist must also confirm a child's diagnosis before treatment, and this treatment can be taken up until age 16. As with children, adults diagnosed with gender identity disorder should be referred to a specialist gender identity clinic. These clinics can provide support and advice about living with your preferred gender role, including mental health support, hormone treatment, ways to dress in your preferred gender role, ways to behave in your preferred gender role, language and speech therapy, hair removal treatments, peer support groups to meet other people with gender dysphoria, and relative support groups for your family. Some people may feel they only need support and advice from the clinic, whereas others may be in need of more extensive treatment, such as a full transition. The amount and extent of treatment is completely up to the individual. Following referral from the gender identity clinic, a full assessment over a period of 3 months is likely, which usually takes place with the help of a psychiatrist. This is a necessary assessment to confirm diagnosis of gender identity disorder. Further health tests will also take place in the case of requests for hormone therapy. Cross-sex therapy is also available for adults, with the aim of helping a person to feel comfortable with their physical appearance and how they feel psychologically. Hormone therapy may be all the treatment a person needs to live with a gender dysphoria. The hormones may even improve a person's feelings of well-being, to the extent that they may not need to start living as their preferred gender or have surgery. The changes that may be noticed as a result of hormone therapy are, for a trans man, you may have more body hair or facial hair, you may have more muscle, your clitoris may get larger, your periods may stop, and you may have an increased sex drive. For a trans woman, your penis and testicles may get smaller, you may have less muscle, you may have more fat on your hips, your breasts may become lumpy and increase in size slightly, and you may have less facial and body hair. If a person decides to go on to have gender confirmation surgery, they will first need to have lived as their preferred gender role for at least a year. A multidisciplinary team will also assess whether a person is ready and prepared to have sex-altering surgery. This will help confirm that permanent surgery is the right decision. After gender confirmation surgery, it is possible that some may face prejudice or discrimination because of their condition. Treatment can sometimes leave people feeling isolated if they do not have people around them who understand what they are going through. They may also be stressed or afraid of not being accepted socially or discriminated against at work. There are legal safeguards to protect against discrimination, but other types of prejudice may be harder to deal with. There are many avenues of support available. Here I've listed a number of contacts that may be able to offer support and advice on gender identity associated issues. There are many more resources available online. However, if you or your child is suffering with gender identity issues, please consult your GP for further advice.